So thank you so much for coming to our presentation today. My group members and I have looked into the demographic of postmenopausal women because they represent a growing segment of the population. And we've also decided to focus our efforts on the newer segment of research, which focuses on the microbiome and how it's tied to health. So to begin, we have a little bit of an overview. Two of the terms that we will be using throughout this PowerPoint are menopause and the gut microbiome. So menopause is this shrinking of the ovaries accompanied by a decrease in estrogen. It usually has an onset at around 40 to 50 years old and is characterized by the lack of a period for over a year. Other common symptoms include headaches, insomnia, emotional changes, vaginal discomfort, and weight gain. And then the gut microbiome. This is essentially the community of microorganisms that colonize our gut. And there have been demonstrated links between hormones and the gut microbiome. Specifically, certain microbiota can deconjugate estrogens into their bioactive form and cause them to recirculate within the body. So as we see here, it's a diagram of estrogen and progesterone, so hormones, over the years. So pre-menopause, there's these high estrogen and progesterone levels, and then during this 45-55 range, we see this drop, and this is where the symptomology usually occurs. So what happens during menopause is that the ovaries are less responsive to the hormones LH, luteinizing hormone, and FSH, which generally regulate estrogen and progesterone. And so because the ovaries are less responsive to these hormones, we see this drop. So what are these symptoms exactly? One of the most common is vasomotor. They're commonly known as hot flushes, and 75% of women over 50 experience them. For those who do experience them, the duration can be anywhere from 4 years to more than a decade. And these vasomotor symptoms can range from not very disruptive to extremely disruptive. And you might be wondering, well, what causes these vasomotor symptoms? It's not exactly confirmed, but it's thought to relate to this thermoregulatory zone. And essentially, what this thermoregulatory zone refers to is this temperature window. So usually, what happens is that you have this zone between the thresholds for sweating and shivering, because we like to maintain our body within a certain temperature. In menopausal women, this zone is narrowed, and so smaller changes in temperature can induce potentially these hot flushes. Another symptom that is experienced by menopausal women is cognitive decline. And this is particularly important to address because nearly 2/3 of Alzheimer's patients are women. Many brain regions controlling memory and learning processes possess estrogen receptors, specifically estrogen receptor beta, which influences brain-derived neurotrophic factor. What this does is it protects the brain and serves to strengthen memory. Decreased estrogen is correlated with lower brain metabolic activity and increased amyloid beta deposits. So if we take a look at the diagram over here, this illustrates something Dr. Larrick had actually mentioned in his speech. He had listed a 18F FDG PET scan, which measures glucose usage. And we can see that in the premenopausal control, there's this high, these red areas, which represent high glucose usage. And then postmenopausal women have a significant decrease in glucose usage. So what this means is that there's metabolic deficits in postmenopausal women's brains. And so addressing these deficits, as well as any deposits of amyloid beta that accrue during this postmenopausal and menopausal time, is critical because there is this prodromal or developmental phase when diseases such as Alzheimer's haven't necessarily manifested, but those physiological changes are occurring. It's also thought that decreases in estrogen accelerate oxidative damage to cells, which really provides an impetus for addressing this as soon as possible. Now, your next question might be, isn't cognitive decline part of normal aging? And you're right, it would be considered a result of normal aging. However, estrogen is thought to increase the effects or accelerate the process of oxidative damage within the brain, since normally estrogen has a protective effect on the brain. And to conclude this point, we have an image here showing the estrogen levels within the body and their effect on, here listed is the mitochondria. So within the brain uses a lot of energy, so it's going to need these mitochondria in order to produce ATP. In premenopause, before the onset of menopause, there's a good balance between antioxidants and ROS, or reactive oxygen species. Now, although the name sounds bad, a normal level of ROS is needed within the body for certain biochemical reactions. And so having a balance is good, but then as we begin to enter this menopausal transition, termed perimenopause, we see that there's a shift in the balance towards ROS, and antioxidants decrease, ROS increases. This causes a decrease in glucose metabolism, decreases in ATP production, and decreases in COX activity, as well as an alternative energy fuel use by the brain, so a more ketogenic versus a glucogenic. And then this is accentuated in the postmenopausal range, where these reactive oxygen species are even present in even greater amounts, and you see this damage to the mitochondria increasing significantly. So these inflammatory responses are potentiated by this decrease in estrogen. Turning to another symptom, more than half of postmenopausal women are overweight or obese. In these women, the decrease in estrogen levels in menopausal women is associated with the loss of subcutaneous fat and an increase in abdominal fat. The decrease in circulating estrogen alters estrogen receptor activations, which can lead to the pathologies such as obesity. And tying this into the gut microbiome, increased permeability of the epithelial barrier has been associated with several chronic diseases, including obesity. And growing evidence indicates that obesity is closely linked with low-grade chronic inflammation, which can lead to metabolic syndrome. So as we've seen, inflammation can really set off and trigger a host of different health effects, and two of those being obesity and also cognitive decline. While obesity itself is a risk factor for cardiovascular disease, menopause can also potentiate or increase the risk of developing cardiovascular disease, again, because estrogen normally has a protective effect on the heart. And as we can see in this diagram, it has a bunch of effects ranging from glucose tolerance, regulating plasma lipid levels, regulating endothelial function, blood pressure, and regulating inflammation. In general, before menopause, women are seen to be less prone to cardiovascular disease. But again, this protection disappears after menopause, and it's heavily tied into estrogen levels. Estrogen can act either through mediators or directly on the heart and vasculature, because there are estrogen receptors present on cardiovascular cells and tissues. While estrogens exert a proactive role in the cardiovascular system, these effects decrease after menopause, and you see an inflammation increase and also an increase in gut leakiness, which is tied into an increased cardiovascular disease risk. And gut microbiota have also demonstrated an ability to potentially modulate dietary lipid composition, something that is, these lipids are very closely tied to cardiovascular disease risk. And so modulating this could potentially alter intestinal lipoprotein formation. And lastly, we have osteoporosis. So again, there's this inflammatory response, and the loss of bone density seen during osteoporosis is tied into the increased level of inflammatory cytokines and the decreased estrogen levels. Normally, estrogen puts a stop on certain molecular mediators that would increase the level of osteoclasts within the body. Now, this leads into the question, what are osteoclasts and what are osteoblasts? If we take a look at the picture here, we have our osteoclasts and our osteoblasts. Osteoblasts are essentially bone building cells, and osteoclasts are the ones that chew away at the bone. Normally, there's a balance between these, where the bone forming cells and the bone chewing cells are in equilibrium, because reformation and remodeling of the bones occurs constantly along lines of stress. However, when there's an increase in these inflammatory cytokines and decreases in estrogen levels, we see a preponderance of osteoclasts, which leads to osteoporosis, which is that more porous bones and that are more susceptible to breakage. So overall, we've seen this common trend of inflammation and gut permeability. Decreases in estrogen can lead to alterations in the gut microbiome, and when these alterations decrease diversity or increase the amount of harmful bacteria, you can have an increase in inflammation and permeability, which then leads to a greater susceptibility to diseases such as osteoporosis, obesity or adiposity, cognitive decline, and CV disease. So as a schematic, we have here on the left a healthy intestinal barrier, and then on the right, an unhealthy intestinal barrier. So here, where my cursor is the intestinal lumen. It's where food would pass through. And we see these bacteria, and this one red one here is called a pathobiont, which is basically the bad guy. But because there's so many symbionts or good guys, there's not enough room for this pathobiont to really grow and expand and form colonies. We also see that the intestinal barrier is very tight and that there's not a lot of immune signaling going on here in a negative sense. So there's maintenance of this healthy barrier, and these bacteria are kept in check and not spreading to nearby tissues. On the right-hand side, we can see that that's not the case. We have way more pathobionts, and they're escaping into nearby tissues and setting off this inflammatory cascade that can then lead to the diseases that we've discussed in the previous slides. So taking a step back to look at how this impacts healthcare, we have a staggering $660 billion in global healthcare costs incurred by women experiencing vasomotor symptoms alone. So this doesn't include the other symptoms that we had just mentioned. We also have an estimated 150 billion of productivity losses from postmenopausal women experiencing vasomotor symptoms. So as we had discussed, these vasomotor symptoms can be very disruptive, and these costs include women missing work because of potentially disruptive hot flushes. Additional costs, and this is for the United States alone, we see hypertension, osteoporosis, and depression, and $68 billion for hypertension, $9 billion for osteoporosis, and $71 billion for depression. So these are, again, staggering costs. And just to put these health issues into perspective, it really provides a really strong impetus for addressing this effectively. So for current treatments, each of the symptoms has their own associated treatments. For cardiovascular disease, while hormone replacement therapy has been suggested in some cases, it's been controversial as a treatment because some studies have shown negative effects on heart health by using hormone replacement therapy. So in these cases, prescription drugs such as statins might be used to lower blood cholesterol, and then changes in diet and lifestyle can also benefit. So increased exercise and healthy eating are always good. For vasomotor symptoms, this is really where hormone replacement therapy comes in strong. It's one of the predominant uses of hormone replacement therapy in postmenopausal women. Other prescription drugs can also be used, and that includes blood pressure medication, interestingly enough, low-dose depression medications, anti-seizure drugs, or those conjugated estrogen or bacidoxifene formulas. Also, home care, so you can have wearing lighter clothing, exercising, and consuming foods that naturally contain soy. Also taking ibuprofen and vitamin E or vitamin B complex vitamins. For osteoporosis, bisphosphonates and monoclonal antibodies have been used for treatment. And then fecal transplant is a little bit of a newer treatment option that uses feces from a healthy donor and transplants them to an osteoporotic recipient. And the hope there is to maintain or restore bone homeostasis in the recipient. For cognitive decline, hormone replacement therapy is used in some cases, although it's not currently an FDA-approved use for hormone replacement therapy. Additionally, acetylcholinesterase inhibitors and NMDA antagonists can be used, and those are commonly used Alzheimer's treatments. Also, exercise and brain training. So physical health is tied to mental health, and then also engaging those cognitive activities can provide benefit. And then for obesity, there are weight loss medications, and then changes in diet and exercise can also provide benefit. So for future trends, we have this menopausal treatment that is governed by a critical window. As that menopausal transition begins its onset, we see these physiological changes occurring, and targeting the population at that time can be really critical for preventing these diseases. There's been new guidance on the use of hormone therapy to make it more effective and safe, because over the years there have been concerns about the increased risk of breast cancer and cardiovascular disease from using hormone replacement therapy. And so currently recommendations are constantly improving to develop therapeutic approaches that are tailored to women and address any family histories that they might have in terms of cardiovascular disease or breast cancer, to make sure they get the safest formulation possible. And there's continued study on the relationship between the microbiome and health, because this is a constantly evolving field, and it's also a newer field. Microbiome is really related to a lot of different aspects of health, and so there's continued research in this area. So why have we chosen the gut? Well, we've seen that the loss of gut barrier integrity really increases the incidence of disease, and decreases in estrogen can influence microbial diversity and composition. So we can see gut dysbiosis can cause a lot of different health effects. And so what we're trying to do is develop a probiotic and prebiotic formulation. What our probiotics are going to do, these are the beneficial microorganisms that we are going to use to prime the gut, and then prebiotics, food for those microorganisms to make sure they can grow and proliferate within the gut. And we hope that by introducing this formulation, we can restore gut barrier integrity lower the risk of disease, and lower the risk of disease associated with the menopausal transition. And so in that way, we can potentially lower these inflammatory states that lead to the host of diseases we had just discussed. And that's why we had focused on the microbiome. So with that, I'll turn it over if there are any questions. And I wanted to also provide a credit to our team member, Naman, for making this amazing 3D rendering of the GI system, the liver, stomach. It took a lot of hard work to do so. And I also wanted to thank my other team members for their amazing work as well on the slides and their continued research into each of these avenues that affect postmenopausal women.